Before we start moving objects or people around, we actually need to move our own body. Our own body is a biomechanical machine that we use every day to do our work. We want to make sure that we're using our body efficiently. So I'm going to run through the basic moves and postures for moving and handling. The first one is the stable stance or a wide base of support. If I put my feet close together, I become quite unstable. To make myself more stable, I'm going to put my feet apart. Wide base of support, stable stance. What this also does is it helps to protect my working space. Often we get jammed up between the bed and the locker and the ivy pole and the equipment. So as much as possible, give yourself enough space to move. Next, we can use the bench position or the semi-squat. That's where we want power coming from our legs rather than from our arms and our back. Tip the hips back, bend the knees, shoulders forward. Find the spot where you're comfortably balanced. Power now comes from the legs. Push up with the legs. Power comes from the legs, up through the hips, up through the core, out through your arms, out through your hands. Our hands are hanging on to the load. So it could be a box that we're picking up or a patient that we're rolling towards us. The key is that we're getting our whole body moving, not just arms and back like that, bending our back over and hurting it. Next is the lunge. 2/3 of our body weight is between our shoulders and our hips. When we shift our body weight from one foot to the other, it creates momentum, and we can use that momentum to transfer through into our load. 1 foot forward, 1 foot back. Start with your weight on your back foot, bring it forward onto your front foot, and back again. So we could be pushing a bed or a trolley, or we could be helping someone stand up out of their chair. We can also lunge from side to side, lateral, using the sliding sheets or the hover mat up and down the bed. Just keep your back in neutral. Don't twist your back. As soon as you twist, you increase the risk of hurting your back. Lastly, we have the Knight's position for all of the tasks that we need to do down or near the floor, whether it's emptying a catheter bag, drying people's feet in the shower, or helping people put their feet up onto foot plates on wheelchairs. What we don't want to do is just bend and snap your back over. Don't use your back like a crane. We can do a squat, but what happens when we squat like this is that our heels come up off the floor and we're quite unstable and we're likely to lose our balance. What we can do is put 1 foot flat. That anchors us and keeps us stable. We've got some options. The first option is to put one knee down on the floor with your elbow on your knee like this. We can do a lot of tasks like this. If we don't want to kneel directly on the floor because it's grubby or dirty, we can use some paper towels, we can use an Inco sheet, we could use a bath towel. Find something suitable to kneel on. If we don't have anything suitable to kneel on, we don't have to put our knee all the way to the floor. So put 1 foot flat to keep us stable. We come down here, our knee is now up off the floor, elbows on your knees, do what we need to do down here, and then power from the legs, and we stand up again.